The strongest data to date, I would argue, is from the IMpower150 study. This is a study that actually had 3 separate arms. The control arm was the E4599 regimen, carboplatin, paclitaxel, and bevacizumab. There were actually 2 study arms, one that just swapped out the bevacizumab for atezolizumab, and one that was a quadruplet. It used all of the drugs, carboplatin, paclitaxel, bevacizumab, and atezolizumab. That study was for patients who had completed their therapy with EGFR inhibitors, and what was shown was that the group of patients who received the quadruplet did have a benefit with respect to progression-free survival, and although the hazard ratio 95% confidence intervals did cross 1, there was at least a numerical suggestion that there was an overall survival advantage as well in that group of patients. Interestingly, there was not a clear benefit, or at least as clear a benefit, when the atezolizumab substituted for the bevacizumab, really begging the question whether there was something particular about the 4 drugs together. That, I think, to date is the most compelling data set. It is not part of the approval for the this quadruplet regimen, but it is something that we are often able to get to patients based on recommendations from the National Comprehensive Cancer Network.